Right now, we're going to turn to a public health warning that we have tonight from leaders in Erie County. The substance called carfentanil has been detected in the local drug supply. Now, it's a substance that's similar to fentanyl that you've heard so much about, though it is up to 100 times more potent. The county health department has found this synthetic opioid in various types of drugs here in our area. Now, the only bit of good news tied to this is that Narcan, which can reverse an opioid overdose, does work with carfentanil like it does with fentanyl. But because of its potency, you may need to use more than one dose of Narcan to save someone's life if carfentanil made it into their system. Now, the discovery of this very dangerous substance comes as the number of people dying from overdoses actually dropped last year in Erie County after a peak in 2023. I talked about all of this a short time ago with Dr. Gail Burstein, Health Commissioner for Erie County. How concerned are you with this discovery of carfentanil here?
Well, in public health, we are very concerned about carfentanil infiltrating our drug supply. So we know that fentanyl has been responsible for, unfortunately, many deaths in our community from overdoses. And you can imagine that we're so worried that carfentanil, that's 100 times more potent, is going to be responsible for even more deaths in our community. So we're aware, and so this is really a direct warning for people who use drugs that carfentanil is in the supply of unregulated drugs, and I mean any unregulated drugs. So we know that fentanyl and carfentanil is being spiked, not only in products that are marketed as opioids, it's also benzodiazepines, like Xanax or something that's sold like that. It's also in cocaine and methamphetamine that are actually stimulants. So I don't think that you can assume that it's not fentanyl or carfentanil is not going to be in any drug that is unregulated that you're not buying directly from a pharmacy. You just have to make that assumption.
We know how deadly, how dangerous fentanyl has been in our community. It's hard to imagine something that's 100 times more potent than that. How are you sort of describing to folks and making them understand just how dangerous this is?
Yeah, well, working with our media partners are really important. And then, also our peers, they're credible messengers. But again, you never know, who might be using in your life that you're very close to, a family member, a household member, a good friend. So that's why that even people who are not using drugs, it's really important to be aware and have Narcan on hand and know when to use it and how to use it.
Fentanyl-laced cocaine has been behind so many of the overdose deaths that we've seen, I guess, over the past year or longer. Is that still the trend that you're seeing, and how worried are you that carfentanil could make that even worse?
Yeah, we are still seeing, unfortunately, a number of our fatal overdoses that have in the toxicology screen, both cocaine and fentanyl, and now we're seeing carfentanil. The good news is that nationally and statewide and in Erie County, our fatal overdose numbers have been decreasing. So we've gone down from 436 in 2023 to so far an estimated 376 in 2024.
Finally, you talk about some of the success that we've seen, although you've said many times one overdose death is one too many. But in reducing that number, it really just speaks to the need for everyone to carry Narcan, right?
Right. I mean, even if you don't believe that you know anybody who's using, you don't know what you don't know. With carfentanil, since it's very, very potent, you'll probably have to use more than you would typically use on somebody else that's using another substance. So just be aware of that because it's really, really potent. Remember, when you're using the Narcan, the point is to keep the person breathing, to keep them alive, to make sure that everybody survives.
Dr. Burstein, thank you so much.
Thank you.